Hi, everyone, and welcome to Crushing Doubts Q&A every week, Monday at 6 p.m. Eastern, 3 p.m. Pacific. Now, of course, remember, we weren't here last week, so when I say every week, I don't actually mean every week, but most weeks. So it is good to be back with you. Actually, I just realized I haven't even started my Instagram. So here we go on the Instagram. We're starting the stream. As always, so welcome everybody on Instagram. As always, we are here to answer your mind-body questions. I look forward to hearing all of the things that you guys have to ask about anything mind-body related. As always, of course, within my system, we're looking at the 3 columns. So if you're trying to figure out what's going on, there are 3 ways to look at it: the emotions column, the doubt column, and the power column. And I will explain more about that for people who don't know that. But for many of you who join me here, you already do know that and you want some more specific answers, and I am happy to bring them. So we're going to start with a couple of preloaded questions, unless people start flooding the questions in, although we've got one coming in already. So I will start with one preloaded question. Actually, no, you know what? I'm going to get to Susan Reynolds' question because she is asking right away. Okay, Susan. So she says, hi, I have a question about the emotions column and symptom onset. I have no difficulty identifying big-ticket emotional themes from childhood, but I don't know exactly when my symptoms started. I don't notice them getting better or worse at any time after emotional events. My parents are both emotionally immature, never take responsibility for their actions. I'm sorry, Susan. That sounds pretty hard. I think it must have been a gradual onset and maybe cumulative from a crappy childhood. Possibly things started around or after my parents separated. Okay. So, Susan, you're bringing up a lot of really important points, and I'm going to go ahead and try to answer them in as organized a fashion as I can. But let me know if I miss anything, or you can do some follow up on the questions. Ashley Carter Asher, though, I see you on Instagram. Mark Campbell, good to see you, and Logan, good to see you too. Long time no talk. Okay, so Susan, I think when you're talking, it says symptoms started over 40 years ago as a child. I didn't know it wasn't normal to have constant muscle pain and heaviness in my limbs. Since then, I added lots of other symptoms, many bizarre. Okay, so Susan, here's the way I want to break this down. The emotions column is for the onset or uptick in symptoms in the present. So, listen, they could have caused the symptoms back then, absolutely, but that's not really what we're going to go try to find. What you're talking about fits more in the power column, actually. It's the story of who you are, how you have suffered, the story of your suffering self. That's the core narrative. So when you're thinking about the difficult things from the past, that's what I want you to be thinking about, is where do those things fit into your overall structure, the power column. Remember, the power column is essentially the emotions column on steroids, mashed up into one big picture event and figuring out how to deal with that. But when you're dealing with things moment to moment, you need to be focused on the present. Okay, so in the present, what we need to be doing is thinking about, well, what's driving things. If you're having symptoms that are an onset and uptick now, that's when we look in the emotions column. If you had symptoms that had an onset when you were in your childhood, though, and they're still there, then we need to look in the doubt column, because that's why they've stayed all this time. So Susan said, that's what I didn't understand when trying to do the emotional column. I see how the past has shaped who I am today and my emotional relationships and mental health. Now I see it's the power column. Great. So, this is a great moment. This is one of those moments where I can show you, hey, look, we just did some really important work. Susan can now carry forward her work in the columns much more effectively because we cleared up a question. And it all came from her asking the question. So, Susan, good job. She says, I don't get any uptick in symptoms or downtick. They're constant 24/7. That means we need to work in the doubt column, Susan. And in the doubt column, you've got questions, just like you did just now. Okay, so we're going to get to more of those. Doris, I see you're saying, hi, good to see you. I miss seeing you on the Facebook group. If you do want to come join the membership groups, please do. I'd love to see you again. But whatever you need, doesn't matter to me whether you join or not. It just matters whether you're getting what you need. Speaking of which, I will be making announcements in the coming week or two to get the next seminars set up. I do believe they're going to be in early February, possibly late January, but I'm not sure. So that's one announcement. The other is to just give a shout out to the membership groups, which I'm finding to be incredibly useful. When I built the seminars, one thing that I found, and I think some people have even said so themselves, is they felt like there wasn't a natural place to go. There wasn't room to see me individually. and maybe they didn't feel as comfortable going to my trained colleagues, though they're excellent. There were resources, but the group memberships allow a way to see me on a more regular basis. They are in groups, but the great thing about it is whether you're talking or somebody else is talking, we learn about the moments, just like we did with Susan right here. Okay, now Susan does say, the only variability in symptoms was monthly period and menopause. I have tinnitus, chronic fatigue syndrome, fibromyalgia, bizarre cold sensitivity, easily catch colds, flus, POTS, constant pain. So, Susan, that all speaks to um, a trauma history because there's a lot of symptoms. But in terms of the work, you're going to want to get to work in the doubt column to figure out why they're staying constant. And you're going to want to get to work in the power column to figure out how you can live your life differently. We need to get you a core narrative. So, Susan, let me know if I can be of help with that. Again, I highly encourage you, if you're open to it, to join my membership groups. I'll actually put the link in there for people in case they need it. These things are working out really, really great. I'm very pleased to see the gains people are making. So let me just get this link in there for you guys if anybody needs it. There you go. Okay, Susan says, are all your Facebook groups paid? Could you link them down below? Also, with seminars, this is a great time of day. Last time I looked, they were too early for Australia time, so I didn't join the group. Okay, so we are working on that in terms of Australia time. I may need to set up an Australia group. We'll see. But we'll keep working on that. All of these Facebook groups, the Facebook groups are a different thing. They're a place where you can go to Facebook, make comments, get comments back. I do weigh in on them, but that's just written. These groups I'm talking about, these paid groups, are Zoom calls where we get together face-to-face on Zoom and we talk. So the Facebook groups, one of them is free. It's called the Mind Body Connection. If you join the membership group, though, there is another group that's more private for the people who are just in that, and allows them to get even more attention if they need it. So, okay, good, Susan. I'm glad you're going to check those out. All right. Well, while we're waiting for other questions, I realized that 2 weeks ago, I was doing the Q&A, and I was missing the Facebook feed. Didn't realize I was. But as a result, I want to make sure to get to that today because some people had some good questions that I didn't get to. And I see that Cody Spot LaBarbara, I think that's Rita again. You changed your name, though. Okay, good to see you, Rita. And Carrie, good to see you. Okay, this was a question from 2 weeks ago from Facebook. Ryan, I apologize that I did not catch either of your questions. I'm going to read probably both of them today if there's time, but here's the first one. Any tips on overcoming time pressure symptoms? When I say to myself, I have to get to work, and I leave my home and feel like I'm rushing. I'm never late, but always worry about it. Do I just need to leave earlier? Okay. I love the questions that you guys ask for multiple reasons. One, hi Rita, good to see you. One, each question has other components to it that I can kind of bring up and get into. So what Ryan's talking about here is this feeling of I have to get to work and feeling worried that he's going to be late, feeling that time pressure. And it's an unpleasant feeling, right? Well, I discovered this actually when I was going to see the therapist that I came to hate. Some of you know that story. One of the things that was actually very freeing for me is because I didn't like him that much, I was able to look at that a bit more. I started to be, rushed to get to the session. Even if sometimes I was even running late, but I would show up running almost just to show him, hey, I wanted to be on time. I really worked hard at it. And eventually I realized, you know what? I'm paying for this guy, whether I'm late or not. So I'm going to stroll in whenever the hell I want to. And that's what I started to do with that. And I understand with the work, it's different. But what you do need to recognize is in some ways, it's not different. In some ways, you're giving away your power to someone else. And I understand it's uncomfortable if you're late and you don't want to make people upset with you, especially when it's your work and, your livelihood. But at a certain point, you get to decide, are you going to keep putting that pressure on yourself or not? And I think that's not as obvious a point as people might think. You have to take a step back and realize that those time pressure symptoms are coming in your power column. in your relation to yourself. You're slipping out of power. Remember, in the power column, there's two main tasks at hand. One is to build the core narrative and figure out if you're living in alignment with it. And the other is to assess whether you are in power and adjust to that. This is a moment where Ryan's not in power. He's suddenly thinking, listen, I'm exaggerating, Ryan, but I'm saying something along these lines because I've been there. Something like, oh my God, I don't know if I'm going to be valued if I'm late, or I don't know if I'll be seen as bad, or I don't know if I'll be misunderstood. But there's a whole thing setting up that you're not in power there. What I want you to do is take a step back and realize you can put yourself back into power. You could say to yourself, listen, I tried to get there on time. If I'm late, I'm late. It's a big deal. I'm still a good person. Doesn't affect anything. You can actually talk yourself through that kind of thing. Okay, Karen Isaacs, good to see you on here. She says, love this question on time. I used to be so neurotic about time. I stopped rushing and symptoms do ease when I don't rush. I'm still never late. So Karen, you've done exactly what I was saying to do here. You took the pressure off yourself. That's what the power column is really all about. It's about your relationship with yourself and realizing there are things you can do to change it. Hi, Mark. Good to see you. Let me know if you have any questions. Very good to see. It's fun. These Q&As, they feel like old friends gathering in a lot of places. And then I get new people popping in, and it's wonderful to see them too. Okay, now Ryan had another question from Facebook 2 weeks ago. I'm going to answer this one. Any tips on, no, it's just a repeat. It's the exact same question. That's pretty funny. Any tips on reading the same question over again? Don't. Not good for the Q&A. Okay. We do have another question, though, from Facebook from 2 weeks ago. This is the last one I did not get to, so I apologize about this, Jasper. And here is your question. Jasper said, I find that my symptoms may be oh, hold on. I've got to move this over. There we go. See, look, I just did a power column thing. You know what I just did? In the past, I might have thought, oh my God, I don't know what people will think of me. But guess what? When your power column's active, and I don't mean this is a bad thing. I care about you guys. I care what you think about me, but I don't care so much that I'm worried. I'm just like, big deal. No big deal at all. So I just moved it over. Now, Jasper says, I find that my symptoms may be a program response that then triggers doubts rather than doubt followed by symptoms. My fight flight gets activated even though I want to be there and my mind is calm. Such a mind game at times. Any advice? Okay, so Jasper, this is one of those questions, and I get all different kinds of questions, but this is a question that I feel like needs a little more articulation for me to know exactly what to answer. So I'm going to go ahead and answer what I think you're asking, but you're going to need to get back to me. Hopefully you'll see this if you're not here tonight. But let's keep digging into this question. I'm going to explain what I mean by that to everybody after I answer the question as best I can. So Jasper said, essentially, he's distinguishing between doubts get triggered and then are followed by symptoms. He's talking about what is essentially a conditioned response, meaning that he's not having doubt thoughts exactly. He's in situations that bring it up. Now, as an example, I happen to know Jasper is a musician, so maybe being in that same situation over and over brings up the programmed response, and then that leads to doubts, and then those lead to symptoms, right? But at the same time, if you're getting symptoms there, they are of the moment. And symptoms that start in the moment, to me, lead towards the emotions column. So what I want you to do is to think about that programmed response. Maybe you are having an emotional response to that situation. And if that's not something you've thought about, I really encourage you to think about that, because the onset or uptick of symptoms, the emotions column is the place to look. So even though you're thinking a lot about doubt, maybe one of the reasons that you're not yet mastering that is it could be that this conditioned response is actually an emotional situation that's leading to things. Now, I understand. Then you said my fight flight gets activated even though I want to be there and my mind is calm. That's the doubt column. That it's already gotten going, but I just want you to tease out the problems. This is often very helpful to tease out the problems and recognize, okay, I got to deal with each one. There may be an emotional situation, an emotions column situation, and a doubt column situation. Now, with respect to that, any advice? Okay, now this makes it even trickier. When you're having a situation where your doubt column's active and you can't get it calm in some way, there's really two ways to go about it that I find most useful. One is to articulate the doubt even more, because the more specific you get things, the more likely you are to be able to get an answer. And that is the part of the doubt column where information is the antidote to anxiety and worry. So that's one direction to go. The other direction you can go is to the power column. The power column is a way that you can sometimes step outside of everything else and just be in the moment and decide, who do I want to be? What do I need here? And it's funny, Jasper, but my hunch is that that's what you need to do, is to focus on the power. And this is interesting because you brought a question that was all about doubt, but this is what I meant by it could deal with some more articulation, because there's emotions column floating in the background. There's power column, floating around it too. That's my answer, Jasper. Let's see what you think about it, and I'd be curious to hear what everybody else thinks about it too. Quilt Hollow, good to see you on Instagram. Okay, Karen has another comment. My symptoms / anxiety kick in big time with background noise when I'm on a phone, when I'm on the phone with a person, particularly with my hubby. I just abruptly had to get off the phone with him. Then I'm mad at him for being annoyed. This noise thing is big for me. I'm constantly telling people, please stop the background noise. It literally hurts me. Then I'm embarrassed. Okay. First of all, Karen, thank you for sharing. Always good to share these things because so many other people out there have similar things. This reminds me of something called misophonia, where you can't stand the sound of chewing noises. But essentially, it is an indicator of trauma to have noise sensitivity. I have it too. Sometimes it's funny. My wife has she has an insulin pump because she's type 1 diabetic, and sometimes we'll be lying in bed, and she gets up and forgets to have held her pump in a certain place, or it's not being held, and it falls and hits the floor, and it makes just a huge noise. And for me, it's like a gunshot. I just am like, I'm so jumpy from my trauma history that it can be very, very upsetting. Now, that's a loud noise, but there are plenty of times where I have noise sensitivity too. It can even happen that I'll be driving in the car and the music is just, it's too loud. I just like, turn it down. And I love music. And sometimes I love loud music. So what determines when we like it or don't? What I want you to do, Karen, is to not be embarrassed about this. Instead, take it as a sign. You know how I say, guys, take your body at its word? Well, your body is telling you you're not in a good place right there. And I understand that uncomfortable feeling where your husband might be upset with you because you had to abruptly get off the phone with him. But the fact is, you've got to give yourself in the power column permission to be who you are, to have the struggles you have. Karen, I want you to see if you can work on this in the power column, to recognize that there's no shame in being who you are. This noise sensitivity, there's a phrase in psychology, which is you come by it honestly. That means you didn't do anything to make it happen, and there was not a chance in hell that you wouldn't be able to have this. Instead, I want you to think of it as a sign of something, a communication of something you're upset about, and give yourself permission to do that. Just like Ryan needs to give himself permission to potentially run late, or I needed to give myself permission to make an adjustment on the screen and not worry what it looked like. We can give ourselves permission for things, and that's what I'd like you to do. All right. Let's see if we have other questions coming in. All right. I have an observation from Bob. Bob said, I'm sensing a need to, quote unquote, become more powerful and less doubtful through working the columns with my core narrative as an internalized subconscious part of me. At some point, the switch from conscious learning to internalized knowing is where I feel for me the magic happens. Magic in quotes. Doubt will always happen, but someday my subconscious will deal with it even before I think about it. Okay, this was a great observation, and I wanted to share it because it really is part of the essence of why the system works. It can feel like a lot of work at the beginning, and I understand that. It's a lot of information. But the good thing about the nature of this information is it is designed to hone things down more and more and more, to make it more and more clear. The 3 columns, they're great in many ways, but one of the ways that they're great is there's only 3 of them. And they have basic rules about why you would be looking at one versus another. Again, I know I give a lot of information, but listen, that's part of the reason people get better in my system where they don't in others. You do need something new to have it work. Now, what Bob's talking about, though, is really important because this is the kind of thing that shows he's more than beginning. I know he's a little further along than that because I've seen some comments from him. He's further along in the system. He's starting to trust, you know what? I don't have to know this now. I just have to work at it and it will become a part of me. And that is certainly what has happened to me. I don't have to think about this stuff much. It is second nature to me. It's like if you play an instrument, you know how to do it. If you are good at a sport, you know how to do it. You might have, bad days and stuff, but you have a skill. If you learn a language, you know how to do it. And you might need to keep practicing it to keep up on it, but eventually it becomes very automatic. And then when you're so good at it, you have no problem whatsoever. When I go to a therapy session now, I don't need to think like I did the first session I ever had, which I still remember to this day. I remember thinking, you think I'm the therapist? Because I was essentially acting. I didn't know what I was doing. I had to figure it out. But now I sit down and I have all the confidence of knowing who I am and how much I've done it. So the same is true with this system. And Bob's saying he's starting to sense that. He's starting to sense that this is going to go from conscious to conscious to the subconscious. And meanwhile, this is another reason that the system starts to work in your sleep. Your dreams start to change. You start to have less and less symptoms at that time because it becomes just a part of who you are. It becomes a part of your identity. These columns are a part of me now. They're not even something that I need to work at so much. Okay, Susan Reynolds has another comment in relation to Karen. She says, totally relate to this, Karen. I have this too, and it's like I already have so much static in my head that any additional noise is overwhelming. I totally get it, guys. I have it too. I sometimes am in meetings, and I'm like, it's too loud, and I turn it down, and then I'm like, oh, now it's too soft. It's this sensitivity to noise, and I'll tell you, it's much worse when I am in trauma, as I put it, meaning something in the present has activated something from the past for me. I always think, oh, it doesn't seem like there's anything going on, but I've learned, take my body at its word. If something like that's going on, something's up. And try to think about it this way, guys. I'm sure you don't always feel that way. And that's a sign of it being a mind-body process. If it were always that way, that would be a different thing. And if it is, let me know because I have a different interpretation of that. Okay, Molly Miniatures. I think you've changed your name from Molly Cakes to Molly Miniatures. Let's see. Oh my, from Facebook to YouTube, there is a little delay. Molly, it sounds like you were on Facebook and you were asking questions, or maybe the feed is delayed. So sorry about that. But Facebook, you're going to hear about this soon. Now, if you're you. Okay. Molly says, Susan Reynolds, I went through it during menopause big time. Dan, are you going through menopause? I did. I am, if I did go through menopause, it was like right from birth. You know what? I've had trauma right from birth. So maybe so. Love Molly's sense of humor. All right, guys. Actually, Molly, I see we have a question here that I believe you asked 2 weeks ago, but it was at the tail end, and I wanted to spend more time on it. So, but I shouldn't brush right past that. I don't know about menopause, from a direct experience standpoint, but it is a point of big irritation for women for multiple reasons. From a physical standpoint, of course, I don't know. I don't have a leg to stand on about it, but I can imagine any physical changes, they bring up a lot of stuff. It can be pretty intense. In fact, this week, so both of my kids have COVID at the moment. After, almost 2 years of avoiding the whole thing, they're fine. They're doing okay. They had some symptoms, some mild symptoms, relatively mild, just seemed like a cold, basically. And they're doing better. My wife and I continue to test negative. We had the boosters, and so it probably is just keeping it to such a low dosage that you can't even determine it. But I found myself physically irritated because I was grappling with the psychology of it. So this is another part that menopause, I imagine, can play a big role. Is, for women, the reproductive cycle and how it relates to self-esteem is, as I understand it, a pretty big deal, and it makes logical sense to me. So in the meantime, nobody likes aging. So any form of aging that's very stark, turning 40, turning 50, going through menopause, having to retire, going bald, all of these things, they can be pretty tough on the psychology. So just wanted to mention that. But Molly had a question that she brought up 2 weeks ago. I wanted to follow up on it. She said, even if reassurance can be helpful, we should not always seek reassurance, correct? I mean, we need to get it from our own thoughts that we are okay. All right. Now, the reason I wanted to revisit this, and I actually did say this last 2 weeks ago, I want to say it again so we spend a little more time on it. The only time that reassurance becomes maybe not such a good thing is if it contributes to doubt. In other words, if you're getting reassurance and you can't get settled with yourself at all, then reassurance becomes a bit of a crutch. And that's what Molly's talking about. Even if reassurance can be helpful, we should not always seek reassurance. At the beginning, though, if it's helpful to you, go for it. Get as much reassurance as you need. But if you notice that you get the reassurance and it's not helping, and in fact, it's just making you more afraid because you're not getting it yourself, then you need to look at that picture differently. Then you need to go to the doubt column and think, why am I not able to just believe this? What's getting in the way? And start to dig in deep. I was in a group membership meeting today, and we hit on a key point, which I'm going to make into a podcast soon. And that was doubt tries to get you to have a more general fear, because general fears can't be conquered very easily. They can't be pinned down. They're very amorphous, and they make you feel hopeless. Oh my God, I can't get better. Like, that's a general doubt. But if you get into the specifics, then you can get further in it. Okay, so when you're going for reassurance, make sure that you are moving in the direction of getting your answers. This fits with the idea that I've put out there of A and B questions. A questions they come from the real you who wants to know more and wants to get better. But B questions come from doubt. They just want to fool you. They want to confuse you. They want to make you hopeless. They want to just get you going in circles. Same is true when you get very general with a doubt. So get more and more specific. So when you're going for your reassurance, just make sure it's driving towards understanding. And make sure that it isn't adding to your lack of power. I guess in some ways, it's a power column issue too. If you're feeling like, oh, I can get reassurance from the Wizard of Oz or Dan or whoever, if you're seeing it as you have no power, then that becomes kind of more of a problem. But people are going to need a lot of reassurance, and that's part of what the membership groups are really particularly good for. Not just reassurance, but also getting more information, but on a regular basis, because it's in the moments that you guys have these situations. Okay, Molly says, I am miniature now, living in a virtual reality, LOL. All right, I didn't know if that was because you were making miniature cakes, or maybe you always have. And Molly says she loves The Wizard of Oz. It's it's a really great allegory. It has a lot in it. And actually, there was a testimonial that we did on YouTube with Patty. She came up with this ingenious way of looking at the columns through the lens of The Wizard of Oz. I don't know if you guys have seen it, but I thought it was brilliant. So check it out. Hi, Vasco. Good to see you. Thank you for joining us here. Please let me know if you have any questions. And hope to see you in those groups soon. I know we were going to try to continue our work. Okay, Karen Isaacs said, I used to need/crave reassurance so much. It was a drug. I know I bring up hubby a lot, but think I got him to teach me lessons. He never verbally reassured me, but he did with actions. Now I don't need it. Okay. So this is important for a number of reasons. One, sometimes you're going to find that people in your life that you need that reassurance from, or you wish you could get that reassurance from, aren't going to be able to give it. They're just not good at that, or they don't get it, or even worse, sometimes they fear you becoming powerful or are being aggressive towards you and don't want you to know. And it's tricky. Sometimes you have to shut those people out. Like I said many, many times, when I was getting better, I basically just turned to me and Sarno. and nobody else. And it can be really good by if you can get people in your life to reassure you in the ways that you need, even if it's not in words, in actions. So Karen, you stuck with it, and he was able to come around and kind of figure it out some, and I'm glad for you. But those things can be frustrating. I totally get it. Okay, Lactation Lady has joined us on Instagram. Good to see you here. Okay, now Vasco, you said, I'm getting better after rewatching the seminar from one symptom, but new ones are popping up. The symptom imperative. Is this better to focus? Is this better to focus on doubt work or power work? Okay. So Vasco, the fact that you're getting better from certain symptoms and they're starting to shift around, remember, in the doubt column, that is a sign of progress. If you came to me and your symptoms were just always shifting around and then they were shifting more and more and more, I would view it more as an emotions column issue that is just getting continued, just very active emotions getting roiled up all over the place. But you had more of a doubt column situation and it's now shifting around. So this is good. What I want you to do now, first of all, you have to continue the doubt work. Keep putting pressure on the on those symptoms. Keep looking for doubt. Because remember, I say you want your search for doubt on a low hum. You're going to go to the emotions column for onsets and upticks. You're only going to use that. You're only going to flip that switch when you really need to. The rest of the time, you live in the power column. So continue to do the doubt column work a little bit in the background, just looking for doubt. But now you're ready to move to power. Okay, so in relation to your question, it's time for some power column work. And I encourage you, come see me in the groups, because I think that's a great place for us to build your core narrative. But find a way to do it, whether you come or not. Just find a way to build your core narrative and get those questions answered, and then start to work on that part. Vasco said, also, I'm still getting the grasp of it all too. Yes, it's a lot. I mean, people say this all the time to me when they come to the seminars, that it's a lot of information. Somebody said it was like drinking from a fire hose. I try not to be quite that bad. And I really think that it's not. It can feel that way when you're in trauma, because then you can't really use the system at all. Then you need to back up, slow down, maybe watch the videos again multiple times, and it starts to sink in more and more. But it's all there. And I've set it up in a way that I think is useful and usable. Okay, Molly is saying, I loved her analogy, meaning Patty's, about the Wizard of Oz. I did too. It was just brilliant. Karen says, just listen to the book Flowers for Algernon, lots of mind-body things. Oh, interesting. All right, I'll have to check that out. I loved that book. I read it in middle school. I haven't read it since, and I didn't really know about the mind-body stuff then, but it makes a lot of sense. Molly says, by the way, my burning mouth is still gone. This is so exciting to me for multiple reasons, but this feels like a victory of the Q&A, because Molly and I have interacted pretty much exclusively here, sometimes with comments on YouTube, but that was a thing that was there for a long time. Now, she says, but my fear of doctors is still here. Ugh. Oh, but not you, Dr. Dan. LOL. Good. Medical doctors, I fear. Yeah, listen, so it's interesting. I talked to my own medical doctor this morning because I was definitely having a mind-body response to the fact that my girls had COVID, and I was worried, oh my God, maybe likely I've been exposed to it, but were the boosters going to work? Was I going to stay safe? What if something out of the ordinary happens? Listen, I have a background of having a father who died when he was 29 years old. I went straight to mortality. I went straight to those worries. Doubt was just raging this morning. Find a doctor, if you can, that you mostly like. Be very picky about it. I can trust him because he understands the mind-body process in not a super sophisticated form, but enough that he could be thinking, all right, well, let's see, is this anxiety? You want a doctor who's at least asking that question and you can talk to about it. And I already knew it was probably anxiety, but I had to ask him. As it turned out, he said, yeah, listen, you tested negative. You would test positive if you were having these symptoms in relation to a COVID thing. Meanwhile, you're not having other symptoms that suggest that it would be that. And he suggested that I take a little bit of anti-anxiety medication, which I have some of for, times where I'm really having a hard time. I don't take it very often, but he said, just take it and see. What happened is I took it a little bit this morning and I was like, oh, the symptoms are gone. Now, that was a way to combat the doubt, actually. But Molly, I totally get your fear of medical doctors. I would say we can work on it, but medical doctors need to work on this too. I think we really need to change the system. We need doctors to understand the mind-body perspective. And but we can talk more about why you may have those, because it can be multifaceted. Okay, Vasco says rewatching the videos and ingraining it into me. That's good. Yeah, when I came to you, it was just one symptom. Now that one is better. Awesome. I'm getting even back pain. Haha, the typical TMSer, even though I never had it or worried about it. So it really is true that as you go forward, you're going to find that the symptom imperative can sometimes bring up new symptoms that you never had before. But the more times you work it through, and this is the way I like to think about it, the more times you work these things through, the more victories you have, the more confidence you have that it all is mind body. I mean, I have so much confidence in it that even this morning when I was thinking about that and I couldn't buck the symptom, I still mostly was just like, no, this is TMS. This is mind body stuff. I don't need to worry about this too much. But it was crossing over into obsession about mortality and being like, oh, if something happens to me, what will happen to my girls? And I needed to talk to somebody. So went in that direction. Okay, Pat's Dynasty 23. Good to see you here. You said, Dr. Dan, that's exactly what I did. I got all 4 books on Audible and watched everything Sarno on YouTube. I listened to it over and over, LOL. I couldn't let anyone else put doubt into my head. Okay, so you were saying in terms of exactly what you did is the same thing I did, which is say, it's me and Dr. Sarno and nobody else. And I really needed that. There were so many other voices and they were all unhelpful in some way. It just was too much. And I say this at the beginning of the seminars. You have too much information and not enough information at the same time. And you need a system and a way of talking about it and a way of thinking about it that makes sense of it, where you don't need other things. And that's really what the seminar does. It makes it so that quest for new information, you can just stop, because I took all the good information and incorporated it into my system. And the not so good information I pushed out. So obviously you have to decide for yourself. That's certainly my assessment of it, but I'm very confident you'll feel the same thing. Okay, Vasco says, yeah, need to dig into all this more and ingrain it. We'll join for sure. Okay, great. So I'm looking forward to working with you, Vasco. It really is helpful, because what we do in those sessions is we pick a moment. Somebody talks about a moment, and there's multiple moments in each session. And we'll go through and I'll tell you, okay, here's how I'm thinking about it. Here's what's going on in this column. Here's why it's this. Here is what I'd be thinking about here. Here is what I would recommend here. And then people work on that. And meanwhile, if you're not the one talking in there, it's still something where you're learning, because you're watching somebody deal with the moments. This is the how-to of it all. So really important stuff. Vasco says, happy for you, Molly. And we all are. I think it's so wonderful. I mean, because you had that symptom for a long time, even during the Q&A time. So really great, and such a building block for the future. I mean, the fact that you mastered that, it opens the door to you mastering all kinds of things. So it's really great. Okay, Bob, good to see you here. Knowing it's all TMS, not various medical labels, is a power column step that helps with doubt as well. That's interesting. I would say that knowing it's all TMS and not various medical labels, to me, is straight doubt column right there. It's just, you have gotten to a place where your doubt has been shrunk so much that you don't need to worry about that anymore. What it does do, though, is the opposite of what you said. I'm not saying it critically, but just to shed some light on it. When your doubt goes down, your power has room to go up. Doubt and power really are like levers for each other quite a bit. So if your doubt goes down, there's a lot more room for power. And as you become more powerful, your doubt goes down and down and down, which is part of what I discovered. As I started to shrink doubt, I was like, I'm starting to feel very powerful. Like I know what I'm talking about and I can do all kinds of things. That's how I discovered the power column. That, and working with a couple of people who were having some plateau issues, that helped me identify that. So I would say knowing that, Bob, means you are really doing some great doubt column work, and that's going to make you feel more powerful. And then you can use the power column as like the place to live. and it's going to feel really good. So keep it up. I've been seeing the progress you're making. You just keep it up. But if you need me, you can join me in the membership groups. You can email me at dan@crushingdoubt.org. I put in the here, I'll put in the link again for them. But there's many ways to get better, included in the seminars. If you can't wait for the next seminar, they are available on video. So that's another thing that you can do. And I have made a lot of progress with the book. It's still going to be a while because I'm going to have to go through and edit it, but I'm halfway through the second to last chapter because my kids were isolated with COVID and there was nothing to do, and I actually had time on break. I don't know what that is anymore. I did a lot of work on that. So just finishing up the power column action step chapter, and after that, it's just the last chapter on the implications of this all. Okay, Molly said Omicron is supposed to be less mild. Or I think you mean less severe, probably more mild, Molly. But maybe that is what your children have. We think so. It's very likely that would be the case based on what's going around and also how contagious it was, because we really have been pretty careful. We unfortunately weren't as careful this past week because I had to go to New York, which was not my favorite place to go to in these situations, let alone having lived there and having it worked my last nerve, as a friend of mine once said. But we had to go there for my brother's 50th birthday, which brought up some emotions column stuff as well. And unfortunately, picked it up there. At least I'm almost positive. So, all right. Pat's Dynasty says, yeah, it was just for the first couple of weeks that I was strictly Sarno. Okay, when he was like just focusing on Sarno and him. Now I am picking through the people that I like. I found you from all the people that you interviewed that worked with Sarno. That's great. I'm so glad you found me, and I certainly like to think that I'm offering something that is different. I more than like to think it, though. I'm quite confident that I am, because I'm offering to you guys exactly what I wish there had been. I've said this. Molly said, "Blame your bro." Ha ha ha. Listen, I probably will. And the good news is he won't be watching this in all likelihood. But if you are, we can talk about it later or not. Power column move. Maybe I won't. But Pat's Dynasty, I'm really glad that you found me. And I say this a lot. It was important to me to start shifting how I work, to make sure that I was not going to do what had happened to me, even in the mind-body world. And that was, I found that there were mind-body informed therapists. And they're very good, especially if the main thing you need is therapy. But if you've done lots of therapy and you need something else, what you really need is a therapy-informed mind-body expert. And that is what I've become. I have focused my work away from the therapy side of things and more on being like a mind-body technician, telling everybody what's happening here. How do we understand it? What do we do about it? And I'm not saying it's easy, but at least I'm doing that work. And I think that's work that that is much needed. Okay, Pat's Dynasty says, yeah, those interviews were extremely helpful for me, by the way. I'm glad to hear it. And tell me how, if you have time. We have a couple minutes left here, but I felt they could be helpful to people just to hear the number of perspectives and different ways to understand these things and see that they're really all fit together. It's a way to reduce doubt, to see it makes sense from so many different directions. Okay, Matthew Smith Undercover says, my brother has been having pain in his leg. His pain usually happens during the morning. He recently admitted to abusing a child in a perverted manner. Should I join or seek medical help? The child is 5. Wow. Okay. That's a pretty serious one. Wow. So the way that I think about this as a psychologist is we are mandated reporters. It means when we hear something like that, we have to report it. You're not, unless you're a psychologist, which I don't think you are based on what you're saying. But I would say that I would say you do need to take some action, because this child is 5. They need protection. A 5-year-old child cannot protect themselves. How you want to go about that, though, you get to think about. Maybe you talk to your brother and say, listen, we have to do something about this. Who are we going to talk to? I don't know what the specifics would be. But I would say that you really need to figure out what you're going to do about it, figure out what you'll be comfortable doing about it, but err on the side of getting that child the help that they need. If an adult is upset about that, I'm sorry, but from a power column perspective, go help that child. We can talk more about it. And if you do need more of my help, please email me, dan@crushingdoubt.org. Okay, Karen says, 2 years ago, I found Nicole and Dan Buglio. Then soon after I found Dr. Dan, you were and are huge in my healing. Thank you. Wish I went to you when you were in Brooklyn. My two friends go to a doctor you trained, and he's helped them. That's great. Fantastic that has helped. Okay, Pat's Dynasty says, yes, that's exactly why. It was great to hear from people that I never met but trusted because I trust Sarno. Yeah, the trust in Sarno, it goes a long way, doesn't it? It was awesome to see so many people that worked by his side and were saying the same things. Yes. Okay, Molly says, good Lord, that is super bad. If that was my brother, I would have to report mandated or not. I'd like to think that in society we'd be moving in that direction. I mean, this is a 5-year-old. We have to protect children at all costs. I mean, I am so ferocious about protecting kids that no matter what you do, you must do something about that. I'm not meaning to come across as pushy. Hopefully it's helpful to you in the situation, but I want to be very definitive. We got to get that kid help. And, in some ways, your brother, that would be getting him help also. It's a different kind of help, but it's definitely needed. So that was not the note I expected to wrap up on today, but I am glad you came to me about it. And I'm glad for any questions you guys bring. And we will keep working to build these columns. And as I have said before, I have all these different resources available. There's the Mind Body Guides if you want to get something in written form before the book is ready. The book's on the way. I'm going to keep working at it. I'm hoping to have the rough draft done by mid-February, and it's looking like that should be a very attainable goal. How long the editing will take, we'll see. In the meantime, the seminars, I'll have one coming up probably in early February. We will get you those dates soon. The membership groups are always there, and I am making a change to them just so you guys know. It used to be that it was every Monday, Wednesday, and Friday of each month. Now I'm going to have it be 3 Mondays, Wednesdays, and Fridays of each month. And the reason for that is it was just too hard with the scheduling to have people not know what they were getting. And this way, if I need to schedule a vacation or something like that, I can do that. But there's still pretty regular interaction. That's a lot of interaction where I can help you go through your moment by moment experience and get you the information that you need. So this has been a pleasure as always, guys. I will be here same time next week. I want to wish you a happy new year because it will be January 3rd when we're back. May 2022 be a great year for us all. I hope that this pandemic is going to start winding down, but I also hope that we're going to continue to make major progress in the mind-body world and in each of your worlds as you build your system within my system. Thank you so much, guys. Please be in touch as needed. And I look forward to seeing you same time next week. Thanks so much, guys.